Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine here. Welcome to our video series for students. Please remember that these videos are not intended to replace clinical rotations, nor are they intended to replace visits to your doctor. If we can be of assistance here for setting up rotations, give us a call at area code 775-359-7111. Please don't call us over the phone and ask us to treat you over the telephone or over the internet. We can't help patients we've not seen. That's dangerous and unethical. But we will be happy to see you same day here. Today what we want to talk about are group A strep infections in places other than the throat. And the reality is this is pretty common, and at least in my community, handled poorly in a lot of our local urgent care. So you need to get a good handle on this if you're a medical provider who's seeing children. Group A strep, we all know about it in the throat. We call that strep throat. We treat it all of the time. It's not always treated very well, but we treat it all of the time. And it's pretty simple treatment. But strep, in reality, can live in any soft tissue, so it's important to consider that. We think about that when we treat impetigo, and we know that group A strep is a common cause of impetigo. And we think about it when we treat cellulitis, knowing that it's a common cause of cellulitis. Realize also that group A strep can occur in the perianal genital area, especially in children who still wear diapers. Group A strep vulvovaginitis and group A strep perianal cellulitis are anything but rare. So how do you distinguish this? And I've seen this misdistinguished too many times to count in the last couple of years. The area of redness is very well demarcated and it is confluent. There are no satellites. Remember that satellites are a major hallmark of candidal infection. And yeah, the candida can become confluent, but it's not well demarcated. The border is rough. The border for group A strep is nice and smooth because it spreads in a nice smooth fashion. Looks like somebody took lipstick or red marker and drew it on the children's genitalia or perianal skin. The skin is hot to the touch, not necessarily raised. Good news is it's treated all the same. Pen-VK or amoxicillin, depending on if you're using pills or liquid, and the same course. How can you tell when you're not sure? Well, you can do a rapid strep culture. Usually you can recover the bacteria from the throat. And that's the easiest place to go after it. You can do leading edge aspirates as well. The leading edge aspirates of the cellulitic area are very difficult to do. Nobody likes having needles stuck in their skin, especially in the perianal and genital area. So I recommend against that one. But do be careful in how you choose to treat. Remember that if this is Candida, you're going to make it worse by adding antibiotics. Having said that, as in the most recent case I've seen where somebody got the bright idea to use lotrazone, that is so many things wrong it makes your head spin. The steroid itself will make the infection worse. We didn't treat the underlying cause. And of course, betamethasone under an occlusive dressing in the genital area results in high absorption, lots of systemic side effects, thinning of the genital skin, scarring. And we don't want to put betamethasone on Candida either because of the risk of causing granuloma formation, granuloma gluteal infantum. So please don't use that. If you're not sure what you're looking at, consult with a pediatrician. We've seen it frequently. We're all very good at making the diagnosis. I hope that this has been enlightening for you and given you something to consider for alternative diagnoses when you're looking at these kids. Remember, strep's not limited to the throat. If we can be of any assistance here, give us a call at area code 775-359-7111. Happy holidays to everybody.